Lube is always something that is highly debated, but here we get a chance to talk to the founder of Glissant Love, Dr. Eilber, who covers all the ins and outs of her water-based FDA-cleared lubricant and oil-based CBD-infused lubricant. Listen in and find out how these two lubes can really take your sexual pleasure, partnered or solo, to the next level. Hi, my name's Laura Mayhofer, and on this channel, I help you gain health through knowledge and movement. Dr. Eilber, I'm so happy to be having you again, having the conversation with you. But because this is a completely new audience, introduce yourself and let people know about your amazing background as a physician.
Hello to everybody. Just for some background, I'm a urologist who has subspecialty training in female pelvic medicine and reconstructive surgery. So I have been focusing on women's pelvic health for the past 20 years, which includes a lot of things like pelvic pain and dyspareunia, which is why I'm familiar with the great work the physical therapist can do, and which is how I started following Dr. Mayhofer.
Yay! This amazing company that you and your co-founder started, which is Glissant, and has two amazing lubricants. So can you tell us a little bit about Glissant?
I would love to. Actually, what I didn't mention the first time we spoke is Glissant is actually French for slippery. So that's how we came up with the name. My journey began after I'd been in practice for several years and listening to women tell me that they need a lubricant and what could I recommend? And of course, you just recommend the things that you commonly had heard of. And then when I actually started looking at them, I saw that they had a lot of just chemicals and no real rhyme or reason behind the ingredients. None of them were really based on what women needed. So just after doing some research and knowing how the vagina and lubrication works, decided to formulate the first lubricant, which is the FDA-cleared water-based formula. Mm-hmm. And that includes things like hyaluronic acid, which of course is a great moisturizer, humectant, and also with lactic acid to maintain the normal vaginal pH and health. And then after that occurred, in the middle of the development of that, my co-founder's sister became ill with brain cancer and had a lot of issues with pain. And the only thing that actually helped her was CBD. And this was several years ago, before it was, a little more generally accepted that people were using things like CBD for medicinal purposes. And so my co-founder said, look, CBD is doing wonders for my sister. If we're trying to make a product to help women with pain with intercourse, why don't we make a CBD product? And CBD is something that you don't learn about in medical school. And so I'm sure my co-founder, she's watching right now, would probably laugh because I fought her tooth and nail and I can't do that. It's not a real regulated substance and this and that. But when I really started to look into it, you learn all of the known benefits of CBD. And actually, interestingly, some of the initial studies have been on the bladder and muscle relaxation for that. Yeah. So, after doing some research, I became much more comfortable with using it. And then, of course, after personally trying it, you really come to see all the great benefits. So not only with pain and relaxation, but also it has some natural anti-infective and anti-inflammatory, what am I trying to say?
Properties?
Exactly.
Yes.
Thank you.
Yes. That's so awesome. So one of the things that I think is really cool, and I grabbed my little sample, my actual full products, is how beautiful the packaging is. So this is the CBD one, and then this is the water-based one. So that has the FDA approval. So I want to start first with this water-based one. And also, as people join or as they're listening, please let us know if you have any questions. But with this water-based one, and with both products, actually, like you showed before, you can just have this neat little refill piece as opposed to having to throw away the entire packaging. So what was one of the thought processes behind being able to do this refill option versus sending out everything again?
Well, first of all, I think most of us would like to be a little green if we can. But, secondly, it was such beautiful packaging. And unfortunately, most beautiful packaging doesn't come, at a very low cost. So, right, one way of doing that was you said, well, the outer shell will probably last a long time. So to reduce costs, you can just get the refill and just replace the outer shell. The other thing is, let's say you really like the gold bottle, but you want to try the CBD, you could actually just order the CBD refill and then use the gold bottle next time around.
Love it. Love it. And so with this water-based lubricant, I think what's so cool, like you were highlighting, is all of the other things you added in. I think a lot of times people, when they think of lube or a water-based lubricant, they think, okay, it's going to be something that is easily washed off, this or that. But because you have it added in with other things, it's like, it's not just giving you benefits during sexy time or during masturbation. It's going to give you those effects long term, which can really help the tissues. So, with this, would you say like individuals with vaginal atrophy, maybe people who have gone through radiation therapy, once they're done, would benefit from some of the longer term effects that this lubricant can offer?
I mean, I would love to say it works as well as a hormone replacement or something else, but certainly using it on a daily basis, you could use it as a daily moisturizer that way. Radiation, as you know, has different effects on the tissue, but, as we talked about in the earlier segment, if a woman has radiation tissue, she really has lost the elasticity, but it's like any tissue in our body. You can regain that, but you've got to stretch it on a regular basis. So we don't think about it, but regular sexual activity is what keeps our tissues in shape, if you will. So, if sexual activity is uncomfortable, you're not really going to be motivated to do it very often.
Right.
So, the woman could use it as a daily moisturizer. She could use it to lubricate like a vaginal dilator so that she can gradually and over time stretch that tissue. I always give my patients the example, if a woman has had like a breast removed for breast cancer and she wants an implant in there. Well, back in the day when you had the entire breast removed, there was nothing left, but a plastic surgeon can put a tissue expander below the skin and it will stretch over time. Just like if someone gains weight, the tissue will stretch, but it takes time. And I think nobody really explains women that, we'll oftentimes just hand her the dilator and not give her any instructions or any expectations. I think women will do what they're told, but it's all in the expectation. If you hand me a dilator and I'm not better in a couple of weeks because you didn't tell me that's how long it would take, I'm going to throw it away, disgusted, and be back in the same place that I was before.
Right. Completely. When we're thinking about using a lubricant like this or a daily moisturizer, when you're applying that, you can really apply, if you think this is 12 o'clock towards kind of your pubic bone or towards your tummy, and then 6 o'clock is kind of towards your rectum, towards the back of your body. Applying that lubricant in the 3 o'clock all the way through to the 9 o'clock position is great. And that's where we have a lot of our connective tissue, so we can work on gaining that elasticity. And when we have that flexibility, that elasticity, that's what Dr. Eilber is talking about, how that will really help to rejuvenate those not rejuvenate, but really allow that mobility and stretch and lengthening through those tissues. And the other thing that I think is so cool about this, and again, sticking with this water-based lubricant, is that it's the sea salt and caramel, which is so cool. So when we're asking people to do things, I'm smelling it now, it smells so good, is that you can ask them to do something and it is so much more enjoyable on multiple fronts. It's not just, it doesn't have a sticky residue. It smells nice. It has a good feel, all of that to make this whole experience so much better.
Yeah, that was one of our goals. I mean, if a woman is using this because, she's dry or she's having pain, if you're already feeling a little down on yourself because, these are things that you don't expect is going to happen to your body. And so as much as we would love to say, we don't get disappointed, we do. Again, we all expect certain things to happen. And so if you're already kind of irritated that that's already going on, it's just nice to have a more pleasant experience, as opposed to opening up, this tube of, plastic tube that's unattractive and doesn't smell very nice. At least this is giving your experience a more positive light.
Yes. Yeah. And isn't it interesting that as 50% of the population, all of us are going to go through menopause. There is no way that any individual who was born with a vulva is going to be able to avoid going through menopause. And many of us who have been on a low dose birth control, so many people are dealing with vaginal dryness symptoms, just even in our 20s. Yet we, like you said, I don't know if we don't expect it, we don't think about it, it's not talked about, but how it's so crazy to me that it's 2020 and now we're finally having things that are made with clean ingredients.
Well, there's always a lag. We kind of take for granted, like even now, clean cosmetics are really more of a recent thing. I mean, if, now that I am, in this kind of business and looking at the benefits of having clean stuff, in retrospect, I'm really sad I didn't understand that, because we've been putting lotion on our bodies for how many years and never questioning. And, skin is your biggest organ. So how many things could we have avoided, introducing into our body? And don't get me wrong. I mean, chemicals and science obviously are great. I mean, I'm a doctor. I believe in that stuff. But I also think that when you can go natural, it's much better to do that. And I think that most people, especially these days, would like to do that.
Right. And I think it's so important to note having a product that when you're thinking about, okay, the skin is the largest organ in our body, and okay, what is that? Especially during these COVID times, what does that mean from a cost perspective to be able to invest in something? I can say if you're going to invest in something like a Glissant lubricant for any skin in your body, the vaginal skin is going to be the most important, because on the inner lining of the vagina, that's a mucosa membrane, versus when we come outside more on the labia, that's still a very thin skin that especially the CBD will be very helpful for. But we've almost got two skin type things going on. And so I would imagine that mucosa is much better at being able to absorb things than some of our outer skin if I were to put lotion on the body. So if I'm going to invest in something, it's going to be something that I'm going to be putting on my nether regions, just like the same thing when you think about what you're putting on or around your mouth, because that's the same concept of mucosa on the inside and then skin that's thinner on the outside.
You make a really great point. We spend our time looking at ingredients in foods we eat, right? We'll spend a little more money to get the organic food, to get the vegan option. We're not just teenagers anymore where we don't have the money or we don't have the knowledge to know. So I agree. I mean, you gotta put a little effort into knowing what's going into your body. And if your vagina isn't an important part of your body, I really don't know what is.
Right. I know. Seriously. I'm gonna definitely, of all the things, I'm gonna spend some more. I know. I love it because I don't think people really realize that your vagina ages. I mean, I'll have women come into me and they'll say to me, like, I think it looks weird. And I'm like, I look and no, there's nothing going on. The doctor gave you the all clear. Nothing is awry. And I'm like, you do realize, like, your face, does your face look the same as when you were 20 or 18 or whatever? And they're like, well, no. And I'm like, well, why would your vagina, you know? And so the same due diligence that we do to this area, we need to also hold that to our, like I said, our genitals, because even though we can't see them, they're just as important.
I love the phrase due diligence. I think it's totally true. And, you know, the example you're using about you have patients asking, do I look normal? There are so many things that women are ill-equipped for getting older, and simply because nobody tells them. Like, nobody looks like Barbie down there after a certain age because of the hormonal changes. So many women don't realize, like, the labia majora, or the outer lips, right? They're equivalent to the scrotum in a man. So they will change and darken with, like, our testosterone levels. And women even have testosterone, believe it or not. That's what gives everybody their libido. But, you know, one of the things I remember, I've been in practice for a couple of years, and you also don't think about, like, the hair down there can also turn gray like the rest. Like, really one more thing to kick women when they're down.
Yes. Totally. The things being food grade, or thinking about organic and what we're putting in our mouth. I think that's also an awesome thing to note about your water-based lubricant, is because you have this amazing sea salt caramel taste and scent that is with this, that it's not some crazy, scary, like, chemical situation. It's food grade.
Right. So not only that, right, we avoid a lot of common chemicals that are found in a lot of lubricants. So no glycerin, that we talked about earlier, potentially can increase a woman's risk for yeast infections, because the glycerin can act like a sugar. So food for yeast. Doesn't have parabens, phthalates, propylene glycol, silicones, a lot of the things that are commonly found in other lubricants. Because, again, back to our skin analogy, I mean, it's your vagina. If you had the choice, you would buy healthier natural lotion for your skin. So why wouldn't you do the same, if not more, for one of your most important body parts?
Right. Exactly. Exactly. And I think nowadays with lubricants, there are so many options out there. And with individuals who, especially, I think we're seeing potentially more skin conditions, I can't tell you how many women come in and they will try that warming, like the warming stuff or whatever. And I'm like, what?
Right. If it's already burning down there, not a good idea.
Yeah, exactly. And I'm like, did you want to crush up Altoids and just throw them on your vagina? Like, that sounds horrible. And I'm like, why does that sound? And they're like, no, it didn't really sound great, but, like, I was in Target and that's what was there. And I'm like, let's just move away from that. So, so I love knowing that about your product. Now the other thing, go ahead.
I was going to say, but, you know, back to what you're saying, there's no guidance for women. Like, how do you choose a lubricant, right? I mean, basically the only thing most people know is there's either oil or water-based, but you don't really know what the basis of the ingredients are for, right? And so, especially with the women who are irritated, you know, to get FDA clearance, you have to do a lot of, like, testing to make sure that it's not an irritant, that, you know, it's not allergenic. So, you know, even women who are very sensitive, in fact, I would say if you're very sensitive, you're better off with the water-based than the oil-based lube.
Yes. So that's what I was going to ask, is what type of hoops do you have to jump through to get FDA clearance? Because I think that is one of the things that I think is the coolest about your water-based product, is that it does have that FDA. And as a medical professional, that puts me at such ease.
Yeah, it's, there's a lot of hoops, and I do a lot of research normally anyway. And so I was pretty familiar with, like, you know, NIH and all that kind of stuff. So I figured, okay, we could do this. I mean, it took us 2 years to get FDA clearance. Well, because you would submit, and you have third-party labs, of course, in the test, because, you know, you can't do your own testing. That would be, you know, not really kosher. But, you know, we'd submit the test and they'd say, oh, you like our condom compatibility. So we tested 2 sets of condoms because there wasn't actually any specific guidance. They come back and say, no, you have to test another type of condom. So it was more adding test upon test, which I can tell you that you should rest very assured that, it's been tested. But, one of the things that's interesting is we wanted the pH to be that's with a normal vagina, but osmolarity is also very important. That's one thing that doesn't get talked about a lot is, as I'm sure you learned in college, when the osmolarity isn't normal, right, the cells can literally explode. Mm-hmm. And so a lot of the lubricants, when the osmolarity isn't correct for the vagina, you actually can cause like the tissue, the cells to die. Mm-hmm. So you might be actually lubricating it, but you're actually causing damage to the cells that are existing. So yeah, there are several things there are very few lubricants that are FDA cleared. So we're really proud of that.
Yes. So, and just for people who, again, are joining in, I think is fascinating. So I did a lot of research on this to try to figure it out and understand it in my brain, and correct me if I'm wrong, but basically, with osmolarity, that's the ability of fluid to move into and out of the cell. So you can have some lubricants which will cause fluid to move out of the cell. So then think of it where that really sucks, because then once you wash that lubricant away, you've now left those tissues and they're even drier, which would just be so irritating. Like literally irritating to the tissues. And then you can have lubricants which will push more fluid into the cell, which can be good, but it has to be a balance, because you can then have the cells be almost hyper filled, and then they can burst. So it has to be this perfect middle ground. So to know that your product is looking at that and was able to find a balance is huge, because it's very, very hard. And it is like I said, researching it, my brain was like, wait a second, college, what is this?
Right. You mean I actually did have to learn that?
Yes.
You are spot on. And, when women become either perimenopausal or their tissues are like perimenopause, in the example used earlier from prolonged use of low dose estrogen, the vaginal wall actually thins out. So if you're using a lubricant that doesn't have optimal osmolarity, not only does the moisture move out, but that actually causes the cells to die, which promotes thinning. So you're actually accelerating the process that caused you to have the dryness to begin with.
Ouch, 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 ouch. Yeah. So that is, and then on top of it, when you have individuals who say have to use condoms, or maybe are trying to prevent STIs, which of course we know when you're having dryness, it can create micro tears, which puts you at a greater risk of STI transmission. It's just this sort of snowball effect where when you use something that is a good lubricant that doesn't have the added crap in it and has gone this extra level to have all of these tests, you have that safety and that knowledge of, okay, I'm going to put this on. It's going to help me while I'm being sexually active. And then later on, it's going to continue to help my cells. So you can use it as a moisturizer in addition to, of course, the lubricant options.
Absolutely. And I love that you know all this, but it also points out the fact that many women don't.
Right.
And you had to do quite a bit of research to find this out. So, I love that we're having this IG Live, because it's a chance for us to get accurate information out to women so that they can choose a product that is right and safe for them.
Right. And now you were saying one of the missions of your company with Glissant Love, which is where you can find these amazing products, glissantlove.com, as well as your Instagram, which is at Glissant Love. Do you guys have a blog on there, or
There is.
Awesome. So
there
I
is
think
a blog.
that's really amazing to encourage anyone who's listening to this, go to Glissant Love, because you know that the information you're going to get is being vetted by a medical professional. So it's going to be good information instead of Googled information that maybe isn't the best.
Well, and not only is the blog vetted by the doctor is writing the blog, which is why there's not that many yet. But the ones that are there are the ones that I thought were the most important. So it explains why it's important to have an FDA-cleared lubricant, the whole osmolarity thing. It also talks about more common things like bladder infections. Why do I have dryness? So I do try to write on topics that I think are important to women, but I am happy to take any suggestions.
Have you created a lubricant company, but you've also created and started to create almost an encyclopedia of information that is safe and correct for people to reference, that will really have that longevity, so that if they are dealing with whatever problems, they can print these out, they can advocate for themselves with their doctors wherever they might be, they can educate themselves, they can educate their partners, and they can get a good product to help them on their journey to wellness.
Yeah, and that's the key. Like, I love the term wellness. Like, it's really about female sexual wellness. And one thing I want to point out that I have really kind of morphed over the years is, again, as a doctor, you're trained in straight Western medicine. And, I only know prescription drugs. What I have learned about herbs and supplements, I've either learned from patients telling me or doing my own research. So like we talked about earlier, the CBD product, we actually formulated that with an herbologist, and I learned so much. And, just like sometimes certain medications will be prescribed with another one to make both those medications work better, a lot of the ingredients that we have in the CBD formula, so specifically the CBD and the CBG, they're meant to work together to give even better results. And these natural aphrodisiacs that are in there, these natural herbs that will actually increase blood flow, which is key to normal sexual function. I'm really proud that, we did the research, we listened to women. I know about women. I mean, this is all that I've done for the past 20 plus years of my life.
Yes. So I think that's really cool. And I'm glad that you helped shift gears, because again, the same, really awesome packaging, like you said, same refill option. I love that it has that spray feature, but the difference with the CBD, for those tuning in, is this is oil based, which is awesome because it has a slightly different experience than that water based. But just from the sense, the slide and the glide that you feel with it. But then, like you said, you have additional things added in. So tell us, what are some of the benefits of that CBD and CBG that work together?
So CBD, I think everybody kind of knows it's relaxing, right? But it actually, you don't kind of extrapolate, and the relaxing feeling that you get, like euphorically, potentially with like cannabis, the CBD can relax muscles, and you don't have, of course, all of the psychotropic effects with that.
Right.
And CBG, some people have coined it like, the mother of all of the cannabinoids, because it is kind of what all these subsequent chemicals or molecules are from. But the problem is you have to sacrifice the whole plant to get the CBG. So that's why you only get very little. So that's why you can mix the CBD and the CBG and get this, what's referred to as the entourage effect. So that actually potentiates all of the benefits of CBD, which include, again, that relaxation. It can help with pain. It also has natural anti-inflammatory and anti-infective properties as well.
Which is so amazing. So when the anti-inflammatory and anti-infective properties, I think, is incredible, because I I feel like the vagina, as we know, is supposed to be the self-cleaning oven, like you had mentioned. But I think one of the interesting things, at least that I've noticed, is as my stress level has waxed and waned throughout, especially this 2020, as I maybe am having to sit more when before I could be up and moving and out and about, all of this stuff, I can tell how just my vagina has kind of changed. So knowing that I'm putting something on it, in it, that allows me to support kind of that area's overall wellness, because I think we can all agree, if you've ever had any type of infection there, man, is it hard to focus and do your day, you know? And so it's really, really nice. I mean, that's one of the things that I thought was so amazing about this, is that it's like, oh, okay, I'm putting something, you know, in a super sensitive area of my body, and it's supporting my wellness, so that I don't have to worry about getting an infection. I don't have to worry about this or that, you know, and I think that's really cool.
I can't tell you how happy it makes me to listen to you, because this is exactly why these ingredients were chosen. Mm-hmm. And, you know, back to you and I kind of being the admitted nerds that we are.
Yes.
So just that everybody's on the same page. So when we say like anti-inflammatory, a lot of pain is because of inflammation. So things like, you know, your Advil, those are anti-inflammatories. Mm-hmm. So yeah, to hear you say all this stuff and that you understand, that you appreciate these, makes me so happy. And I just want to get the word out to as many women as possible.
Yes. So, and one of the things that I see as a physical therapist when I'm working with women who have inflammation, or anyone with a vulva who has inflammation in their vaginal area, who has pain, who has tight, tender muscles, it's always so much better if you can put something locally on the tissues. So if I'm going to put something locally right here where we've got the muscles that are right underneath this area here, it's so great to put it right there, and then versus taking something orally, where when I take something orally, I have to wait however much time it has to get dispersed through my entire system before then maybe it'll affect here. But usually whatever is going on at the vagina and vulva is always multifactorial. It's usually there's some dryness going on, there's some tissue tension, there's some inflammation. And so that's what I think is so cool about the CBD, is it hits multiple things. It's going to soothe the skin. It's going to increase blood flow to get the relaxation. It's going to do all of these things. So, and then you're putting it right on the spot. That's the problem versus trying to treat everything.
Well, and what's nice too is, like you said, if you get it on the skin on the outside, it's just soothing and moisturizing for the outer skin as well. You know, another thing that I think makes our product really unique is, yes, it's formulated by a doctor, FDA cleared for the sea salt and caramel. That's all great. But my co-founder, who really has been in the beauty industry for years, I think puts an extra spin on it. You know, I mean, she really was behind a lot of the packaging. And, you know, as a doctor, I'm like, let's just fix the problem. But, you know, beauty is an experience. And so that's why, you know, we wanted to get a scent that wasn't too overwhelming, and that in your mouth it wasn't too sweet. And even the CBD product, we wanted to make sure it wasn't too, you know, it's, for a lack of a better description, I think it's kind of earthy and natural, but it doesn't taste like weed, if you will.
Yes, no, it's a really lovely experience.
So I think that, and I like to hear that. So it was really important to us that it was something that was going to really help women. It was going to give you a better experience. And it was something that you weren't embarrassed to throw in your bag, or, you know, you can put it with the rest of your beautifully packaged cosmetics on your bathroom counter. But one of the things also that really drove, we already decided we wanted beautiful packaging, but one of the things that really drove it in was my co-founder was traveling, and she decided to bring some work with her. So she threw a bunch of lubes in her carry-on so that she could kind of compare them and whatnot. And the TSA agent like made her empty, because I guess one of them was more than 3 ounces.
Yes.
So he made her empty out her purse. So she probably looked like, you know, some
Yes.
oversexed something with like all these. It was hilarious.
Yes.
So she was mortified. She said, for sure we have to have packaging that no one's going to know what it is.
Yes, yes. And that's one of the things. I feel like it looks like a beautiful perfume bottle or like almost like a mascara tube. You know, and I love it because it still has a ton of product in there, which
There
is
a
really
lot of product.
Yeah, it's just amazing, you know, and I'm so impressed with that piece of it. And so it's nice because you can, like, I had this sitting on my bedside table, and I have a cleaner that comes in, and she would never know what it is. It could be my pillow spray for all she knows, you know. And so I really, really think that's so fantastic. And I love the packaging on the top. If you guys can see that, there's just a lovely little water there versus the little CBD option there. So again, it's a very quick reference. So it makes it easy. It makes it fast. You don't have to lose any time. It doesn't need to be awkward. It's a super easy spritz for both of them. It has not gotten clogged or anything for me. So I really, really enjoy this. It's nice if you want to spritz it, if you're using like dilators to help stretch and open that vaginal canal, or a vibrator if you're masturbating on your own and you don't want to get anything on your hands, or you really want to make sure your product goes a long way, you can just spritz it on there versus having to pour a bunch out and then like, oh, my hands, and like, what do I do with this kind of thing. So you both really put a lot of thought into care into this experience from start all the way to finish, which is incredible.
And, you know, the two of us also can't take all the credit. I mean, we, of course, had to work with chemists and the herbologist, you know, to make sure we got the pH, the osmometer, all that stuff. But yes, we definitely put a lot of thought into it. And, you know, back to also the scent and the taste, we also did that so that any kind of oral activity was a little more pleasant.
Yes, which is so wonderful, because I think a lot of times people always sort of think of sexual activity as like, okay, I always think this is funny. I have so many patients where I'm like, all right, so what do you guys do for foreplay? And they're like, what are you talking about? And I'm like, right. Okay, guys. So I think
like, is that when we look at the Instagram feed?
Yeah, exactly. And I'm like, okay. So I'm like, I liked how you had mentioned again on our earlier talk, as you start foreplay. So if you're someone that struggles with pain, discomfort, with sexual activity or in general, put this on about 10 to 15 minutes prior. And then when you're ready to go ahead and have penetrative sexual activities, you've got that kind of maximum benefit, and you can go ahead and go forward knowing that, okay, I've got that relaxation, versus a lot of times people are like, okay, and now it's go time.
Well, you know, and back to your comment about the foreplay, I mean, you can get a little more creative with this. So you can have your partner, you know, place it internally for you as part of the foreplay. So, you know, it's, look, I don't know, you know, if you're married, whatever it is, but I've been married. My husband and I, we dated for 3 years beforehand. So in another year, I'll have been with him longer than I've lived my life without him.
Woo-hoo!
So, right. But that also means that you've had sexual activity with the same person for a long time. So my husband's probably one of the biggest beneficiaries of my new product.
Yes.
But, you know, but it just changes things up and just makes things a little different. And I also, you know, you treat men and women, and as a urologist, I treat actually a lot of men and women and sometimes couples. And I find that it's a shame that, of course, they love each other, and a relationship is not just about sexual activity, but for most couples, it is an integral part, and it's a different level of intimacy. But because one person has pain, you know, they just kind of put it by the wayside, especially if they do have a strong personal relationship, because they figure, well, that's okay. It was great once.
Yes.
You know, we still have our friendship, you know, or whatever they have. And they don't realize that it's not that hard to regain that. But who do you talk to about
Right.
that.
Right. Totally. Totally. Yes. I've heard the statement, like, it was fun while it lasted. And I was like, oh no, that hurts my heart.
Yeah. I mean, that's like saying, well, I turned 50, I can't do yoga anymore.
Yes.
No, of course you can't. And I mean, like everything changes. The type of yoga I can do now is not the same as when I was 30, but I sure as heck, I'm not going to stop.
Right. Exactly. Exactly. Like you said, it can really reinvigorate things, because I feel like lubricants have been sort of this thing that's like, buy the condoms. You have to kind of like get your cart ready and be like, okay, I'm going down the aisle with the lubricants, and you just like don't even look and throw it in there. And it's like, okay, what is this that I'm getting? Versus now it can be something that's just such a more holistic experience all around, which is, again, so, so, so beautiful.
But it's like you said earlier too, with like the heated one. So you're
Yes.
already having like some burning sensation down there, right? Like getting a lubricant that feels like fire. It's probably, the burning bush is just not a good
Right.
scenario.
Yes, no. And to me too, it's like, when I'm thinking of sexual activity and all of that stuff, it's like fire, heat, like true fire, heat. Like, yes, I want it to be hot and sexy, but I don't want it to like literally be hot.
Right.
Like,
right.
I want it to be like, when I think about it, it's like, I think with both of your products, and like you said, the word glissant meaning slippery, right?
Correct.
Yeah. So it's like, we want that sliding, gliding. Like you know that when you get that weird friction, it's like, it when it happens, and you're like, oh gosh, okay, hang on 1 second, hang on, and so, I think that this really alleviates so many things, where it's going to get rid of or significantly minimize that pain with intercourse. And then also any of those not so great symptoms that can sometimes happen after intercourse. I mean, there was someone that posted the other day on Instagram that said, sex is an athletic event. And I have to agree. I mean, you need to be able to be in, to have some degree of hip flexibility, of core strength, of, all of these things to be able to enjoy it. And, I like that both of your products are things that, you're not going to have to worry about, okay, am I going to have a yeast infection now? Am I going to have a UTI now? Is this going to happen now? It's like, nope, I can rest assured that those don't need to be concerns because of how you formulated the stuff.
Well, I'd love to claim that would never happen, but
yes.
Women, it's going to it's going to hopefully reduce your risk.
It's going to reduce the
yes. It's not a total miracle. But I back to what you made a comment earlier. Lubricants, they've just been, equated with, right, either only using toys or, with that woman who's so dry down there, and you get this image of just, this decrepit looking old lady, but that's not really the case. And okay, yes, low dose birth control for a long period of time is one culprit, but people who have to take prolonged antihistamines or things for other medical conditions that just generally dry you out.
Mm-hmm.
Correct. Or even people who have certain tissue conditions, like scleroderma or other connective tissue disorders where the tissues aren't elastic and they're drier. So, there's something for the viewers, there's something called Sjogren's syndrome where people just get really dry everywhere. So, things like this can help all sorts of people. And, it's great, again, that like things like your Instagram channels will help to just normalize something like the use of lubricants, and not just with certain scenarios like using sexual toys or, in the porn industry or something like that.
Yes. So one thing that popped into my head earlier, and I'm glad you just outlined other reasons why, or other groups that would use it. I have recommended this hugely to my postpartum ladies. So anyone, I know I have a lot of moms that are watching this, a lot of partners who have individuals who have had babies. hugely important, because breastfeeding will will decrease the estrogen and will actually cause that dryness. Right as we're talking about, when we keep talking about these areas, it's really in this kind of 3 to 9 o'clock position, but very commonly just right here can be a real culprit of things. And we will start to, it's amazing to me. I'll hear people and they'll say, I felt a little bit of discomfort, but I didn't really do anything about it. And they kind of keep pushing through. So if you have any of these things, if you're going to be having a surgery or you had surgery, start to think about, what does my body feel like and how can I best support it? Personally, I'm someone who started using lubricant when I was in my early 20s in college. And I luckily had a group of friends that were extremely supportive. We were all kind of in the same boat, on different medications for different mood disorders, on our different birth control, all of that stuff. And it's something that I've been able to incorporate. And it doesn't surprise me that I felt so free talking about it then, that I'm now doing what I'm doing now. So really, if you're any individual from 20s all the way up until, 90s, lubricants are so important to use.
Until you've exceeded your number of allotted orgasms.
Yeah, exactly.
But yeah, and that's great. But unfortunately, you're probably more the exception than the rule. Women don't feel as empowered. And I'm glad you brought up the postpartum thing. So pregnancy and delivery are very much romanticized. And listen, don't get me wrong, I've had 3 kids. It's wonderful, but the only really satisfying part is you get a baby. The rest of it is hard. I mean, if you're fortunate to have an uncomplicated pregnancy and delivery, that's great. But again, you're the exception, not the rule. So where you're pointing out that 6 o'clock position, that's where every woman either tears or has an episiotomy. Okay. And like, no one actually tells women it is not possible to be the same after you've had a vaginal delivery. So many women are very disappointed that they don't feel the same. They don't look the same. Sex doesn't, it sometimes can be painful. And it's just reassuring. If women just knew that they would expect that, it wouldn't be so, again, disappointing to them. And back to the breastfeeding, that is one thing that I see very often. So especially like women who have a lot of kids like back to back, where you're basically either pregnant or breastfeeding, that's like being on a really low dose estrogen all the time. So even when they finally recover from childbirth, sex is so painful that they don't really want to do it. And then between all the kids waking up and you want your sleep, fast forward, now it's been a year since you've had sex. Oh, guess what? Feels even worse. So again, you lose that motivation, and there's not really a place for women to go and say, hey, what can I do now? I'm ready to regain my sexual health.
Yes. And it is something that I love how you said how it's romanticized. And I know you know it because you're out in Beverly Hills. So I am like a huge, I love those gossip magazines. I know they're horrible and they're lies, but I don't care. I love them. And so,
probably not all lies.
Yes. And so you see the person where it's like they were pregnant and then they're like a week later or 3 days later, or they're like discharging from the hospital, and some of the celebrities are like back in their jeans already, and I think, again, we don't have these conversations of there is skin changes and, and we want to be able to, support women on that journey. So, it's so incredibly important. And again, with that skin being so sensitive, having a product that has really clean ingredients in it that will be very gentle on sensitive skin is hugely important.
Yeah, I just think that, again, if women knew this would happen and it's common to occur, it would be so distressing to a lot of women.
Yes, exactly. So, So I absolutely love, like I said, absolutely love these products. I think they're so incredible and great. I just, like I said, I'm tickled over the packaging. Speak your praises enough because I think that this is so cool. And
I
it's
love
been
that. Thank you.
such a pleasure speaking with you. So, like I said, you can find Dr. Eilber in Beverly Hills, California, and you are at Mount. Do I want
Cedar Sinai?
Cedar Sinai. I always want to say Mount Cedar Sinai.
There is a Mount Sinai in New York.
Yes. Okay. I know. That's where I always get them confused. So Cedar Sinai, you're still a practicing physician, which I think is so huge and speaks volumes to your dedication to your profession and your patients, and then also clearly your dedication to this product, because I know starting anything new, uh, especially during COVID times, even though I know it's been a long process with just launching now in March, that you have to be very, very dedicated and really believe in your company and your product. I think is people can really rest assured in that.
Oh, my co-founder and I, yes, we very much believe in it, and probably more so believe in women. And
Yes.
Really, our mission really is to help women. And there is a little bit of an ulterior motive. I mean, we are the demographic that we're aiming at a lot. There's a comment here. Put gentle baby.
Yep. Put gentle baby on the peritoneum.
I think she means perineum.
Yep. Yeah. Oh yes, perineum, and it will not tear, and it'll put elasticity. Yes. Yep. Yes.
Yeah. So, anything to moisturize and make the skin healthy. You know, it's think about it as your own skin. Like I try to explain to patients that when the vagina is dry, it's like if your skin is dry, it tears easier. It's much more sensitive. So yes, like you were saying earlier, put as much care into down there as you do the rest of your body. Yes. You know, it's something that we're not kind of taught to do as part of our regular hygiene routine.
Right. Exactly. Yeah, I always tell people, I'm like, you gotta love your vulva. You just gotta give it some love. And they're always like,
what's a vulva?
Yeah, exactly. And they always get like bright red cheeks, and I'm like, just love it a little. Just like take a peek at it, say you love it, and they're like, oh geez. So I think like your products really, 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 really help with that, which is beautiful and amazing. And I am so grateful again that I could have these conversations with you today. So incredible speaking with you. And please, please, please continue to message us and let us know what's going on so we can continue to share the love about Glissant love and all of that jazz.
Oh, I so enjoy speaking with you. I knew it was going to be good just following you on Instagram, because all of your posts really they're very educational, very accurate. And I won't hold back saying that I'm very critical. It's like being a physician watching the show ER. Like it's so painful to watch when it's inaccurate.
I know.
I love your post. Thank you for having me. Really, really appreciate it.
Thank you so much, and have a wonderful rest
of your day. Thanks. You too. Bye-bye.
Bye.